So welcome to today's Engaged Learning Forum. We're excited to have you here with us. As I mentioned, we're excited to hear from Dr. Maria Alexandrova about her work that she's been doing this summer in the midst of this uncertain time that we're all facing in many different ways. This is an Engaged Learning Forum as part of our series at the Center for Social Concerns that allows us to bring people together to have conversations about best practices and experiences related to community engagement and service learning and those kinds of approaches. Especially at this time, as we're all figuring out what this means for us moving forward. This is, I think, an especially important space that we can come together and talk and to collaborate and to think about what we can be doing to most effectively work with our community partners now and into the future. I'm glad that we have some community partners in the Zoom space with us today. As I mentioned, our presenter today is Dr. Maria Alexandrova. She is an assistant professor of the practice in the Department of Biological Sciences and at the Eck Institute for Global Health. Her presentation today will be on the sustainability of a community participatory research project in the time of COVID-19. I want to direct everybody's attention to the Center for Social Concerns website. We have an Engaged Learning Forum series page there where there is more information about our upcoming events as well as some previous Engaged Learning Forums that we've had in the past. We had a number of wonderful conversations over the summer with a number of community partners, and we look forward to, building this space and having it be a place where we can come together both on campus and off to talk about issues that relate to each of us and to the local community. So with that, welcome Dr. Alexandrova. Thank her so much for spending this time with us today, and we'll turn the time over to her.
Yeah, thank you very much, David. Thank you for welcoming me. I would like to thank Center for Social Concerns for giving me an opportunity to share experience with the research project that is currently running and is supported by Community Impact Grant from Center for Social Concerns. Just my small background. I am a core faculty at the Master of Science in Global Health program in the role of Assistant Professor of the Practice. And my background encompasses medicine and health education. I am a medical doctor, obstetrician gynecologist by my initial training. And then I got doctorate in health education. I got engaged with the University of Notre Dame 2 years ago through Masters of Science in Global Health program. My research interests naturally fall into women's health, maternal child health, cancer prevention, use of technologies in health. And I have been doing research, surveying different communities before on knowledge, attitudes, and behaviors regarding human papillomavirus, human papillomavirus associated diseases, and human papillomavirus vaccine. And coming here, I was happy to continue my agenda focusing on that. And it was even more boosted with the support of Community Impact Grant. So I was able to create a team with our major community partner, St. Joseph County Health Department. Particularly, I know by this time everybody are familiar with Dr. Mark Fox, who is deputy officer there, as well as he is a dean in IU Medical School, and he is engaged as our major community partner for this project, since St. Joseph County Health Department had on their agenda as one of the aims to increase human papillomavirus vaccination in St. Joseph County. It is well known that in the US in general, but the rates for this preventive vaccination is pretty low and unevenly distributed, and St. Joseph County is not exception. So we offered an approach to survey major decision makers in children's life. That's when this vaccine is medically recommended as a 3-time series between ages 9 and 17, with the highest efficacy immunogenicity rate to prevent carcinogenous types of human papillomavirus, and thus prevent multiple cancers associated with human papillomavirus, such as cervical cancer, vulval vaginal cancer, anal cancer, oral and throat cancer, penile cancer, as well as some recent studies showed that HPV is associated with non-melanoma skin cancers. So some of those vaccination benefits can overlap to prevent these types of cancer as well. So we offered to survey major decision makers, and major decision makers for vaccination in children's life are parents or guardians of children, as well as their primary healthcare providers. So we decided to target these two groups with initially it was our aim to have electronically distributed survey assessing how assessing their confidence, compliance, and convenience regarding this vaccine, in order to identify particular barriers that exist in St. Joseph County. And in a bigger run, bigger aim that hopefully we will be able to implement after we analyze results from this survey, will be to offer a tailored program that of HPV vaccination that can be offered through St. Joseph County Department of Health. So this is the background of our program, of our project. So initial timeline for our project was that we will receive all the institutional review board approvals by the end of the spring semester, and then we'll roll out the data collection phase in the summer, months. However, that had to be adjusted because of pandemic, that created certain barrier for us for initial ways of recruitment that we planned. For parents, we planned to recruit them through public and private school systems within St. Joseph County, and asking them to use their listservs and basically mail, survey link. However, with the pandemic, we realized quite fast as a team that we cannot burden our school systems and their administration with this request, because their priorities at this time, and still is at that time, was finishing up school year for children, in the summer to prepare for the upcoming school year, and now managing that. So this venue became completely unavailable to us. So we had to put our heads together and think of what else will be possible venues for recruitment to reach parents and guardians for that part of the survivorship. And it's been decided that we will try to reach parents and guardians through creating relationships and contacting local churches regardless of denomination. Since we had to change completely our recruitment strategy, we had to, of course, file amendment to our initial IRB application, which was again a little bit added to the delay in the timeline that we initially anticipated. However, we received that approval, and we were able to proceed. However, another so that basically, sorry, I got a little bit sidetracked. So then also there was a very important moment to update Center for Social Concerns on the progress of our research and what we are doing to continue it, and what adjustment we had to do. So it was great that when I reached out for support to Connie Meek and David Lawson, they met with me right away, and I updated them what we are going to do, and they were happy to support it and approved our strategic replanning for this. One of the other kind of unexpected barriers that was encountered is that in this project I had two undergraduate, very devoted, brilliant undergraduate students who were engaged from the early on from writing a proposal, literature review, creating survey, adapting survey, putting it on Qualtrics. They performed excellently, and they were eager to start data collection in the summer. This had to be shifted, and now we started to collect data about 3 weeks ago. But then related to the students, there was a kind of hiccup on that university wide center policy on making sure that students who are going to be engaged in research activities during the summer are going to be approved to ensure their safety. And so that took almost the whole summer for me to get that approval, even though all the documents were provided. It was explained that students are not directly going to, contact participants. It's all, data collection method is through online distribution. And I think that, again, my conversation with David Lawson and Connie Meek and engaging their support helped to move that tide. And that was eventually approved, but it did shift our timeline by 3 months. And what I personally learned from this experience, that one has to exercise a lot of patience and trying to diligently follow new policies and guidelines from university, find certain way of resilience and keeping community partners as well as your research team engaged and still excited. And then there will be opportunity to proceed. So for me, it was a big learning experience and perseverance to be able to sustain this project through the developments that happened in the community and at the university due to this pandemic. Also, regarding the second population of doctors that we initially planned to engage as visiting their offices and distributing surveys, that was again became out of question at that time due to the precautions for one's health. And we basically decided to again trying to use electronic format of administration of their survey through contacting managers of the offices and engaging them to take part in our study. At this moment, I think that I can report that the part of the study that engages parents and guardians are going quite successful. We receive wider quite an acceptance from local churches to distribute their surveys either through their listservs of parishioners. Some of them were even distributing a flyer during Sunday services as a part of handouts or putting flyers on their advertisement boards, which I find very, very phenomenal, that such a great support was provided, is provided now for students who are doing this part of work, contacting churches. They keep a roster, spreadsheet roster, who contacted, when contacted, and then they basically so far kind of track just how many responses were received. We don't have any preliminary data to report yet, but as far as that part of the recruitment goes, it's going well. Regarding physicians, it's always very hard to reach out to this population and engage them in the process. So so far we don't have as fast response from this community, but we also hoping that our community partner, Dr. Mark Fox, will continue to provide support, and will be able to contact physician licensure board for primary care physicians and help us with the survey distribution. And also, as a pandemic, the numbers of people affected are going to go down. We will also consider to visiting offices and distributing flyers. One more very, I think, important moment to mention is that one has to keep a team informed on developments. Anything that changes recruitment process has to be refiled as amendments through institutional research board to make sure that research projects are meeting compliance for human subject at all times, as well as keep other stakeholders updated. We do use incentives for our participants, but as upon guidance from Dr. Mark Fox, we do not provide anti-incentives for physicians, but we do provide incentives in the form of $5 gift cards that parents, guardians, participants can acquire after completing survey. And the funding that we were able to secure for it is for first 100 participants. And one thing that I want to mention that about that when I had my conversation with David Lassen and Connie Meek over the summer, since our data collection haven't started yet, we as a team thought to maybe we should increase the amount of incentives and have it as a raffle lottery. But David provided guidance that was initially, that's what we planned, to have a small incentive, but to available for a bigger amount number of participants, and we took this as a direction to follow, and we basically adjusted once again this for our project. Again, some of the major lessons that I've learned, that it's very important to have conversations with your research team and stakeholders like Center for Social Concerns, because it does provide guidance and empowerment for the project to continue. I find it that my team, me, and this project was received outstanding support from the center, for which I'm very grateful. And I will stop for a moment now. I would like to have your questions, but also I would like you to maybe put in the chat what are some of the barriers that you experienced over as pandemic struck, or you are still experiencing.
Barriers to healthcare in particular, or?
No, anything that kind of, didn't work out as was initially planned, and maybe like what I planned, like how did it work, or it's still, kind of pending.
Could I ask three questions?
Yes.
One would be, how did you make the students aware of the opportunity to participate in this kind of research? That's one question. The second question is, typically what majors were the students that participated? And the third question is, what kind of credit did they get? Did they get credit through a biology course or some other discipline?
Yeah, that's a great question, Dan. Thank you very much. How students learned about this opportunity. Basically, I was contacted at the very end of the fall semester 2019 by one of the students who sought me out herself through, I guess, reading some profiles of faculty, and I met with her, and I had this project in planning phase, and asked her if she will be interested to participate. She was very excited, and then it turned out that she recommended her friend to talk to me, and if there is room to engage her. So I was happy to do that. They are both in the College of Science, pre-med majors. And what they received from it, I directed reading course through Global Health was created in spring 2020. Their summer internship with me was supported by Community Impact Grant. And as for the fall, there is undergraduate research course created through biology department.
Thank you.
Was that fall course always part of your plans, or was that what you created in part to respond?
That was tailored. Both courses were tailored just to meet needs of the students. I was very happy to accommodate them. I was very happy to provide for them, benefits that could be available and enhance, their curriculum and their learning, both in the spring and the fall. They were just, created to accommodate needs.
Maria, good morning. I have a couple of questions for you. The first one being, I've heard the Department of Health talk about low immunization rates across the board. Has there been opportunity, or do you see it as perhaps a negative that HPV gets lumped into all the rest of the immunizations, or does that provide an opportunity to raise community awareness about making sure your kids are vaccinated? That's one question. And then my second question is kind of back to the data piece. I'm curious, there's state data on immunizations, there's local data on immunizations, and there's a couple different sources in the community to get information from. I'm just curious to know if the Department of Health was able to be that data provider for you, or is that the plan, or are you going to a different source such as the Indiana State Department of Health or our local MIN/IHI to help with that?
This is great. So I'll go to answer second question first, I guess. It is a difficult process to obtain up-to-date information on vaccination records for the county, as well as particularly for human papillomavirus vaccination. And actually our source that we were able to learn about this gap was Blue Cross Blue Shield records, public records. And the most actually recent one that was provided was for 2016, that stated that only 31% of all adults have completed vaccination in South Bend, Indiana. So it's not even encompasses the whole county, but we were not able to receive any summarized records as of yet, at least. We were not able to receive those, but it is as on the national level, Indiana currently ranks at 35th place out of 50 states on immunizing females against HPV, and on 43rd place on immunizing males. So overall, Indiana is falling behind, and the rate for St. Joseph County, I don't think that at the moment there was a big increase in past 4 years since 2013. So about only 1/3 of adolescents receive this benefit of this vaccine protection. And sorry, what was the first?
Thank you. Let me just add too, if you're interested, maybe I can help you try to identify some other data sources on that.
Oh, thank you.
Of interest. The second question was, because immunizations are low across the board, does that help your research, or is it kind of hurting, or is there an opportunity to partner just to get the awareness out?
Yeah, I do hope that there is opportunity to raise awareness among community by engaging people in participating in this research, because we are assessing on three major domains: confidence, compliance, and convenience. confidence being encompasses how safe this vaccine is and how knowledgeable population about this. Compliancy, if since there are still, now there are a couple of different vaccination regimes available. If it is done under the age of 14, only 2 doses of vaccine is recommended. Older than 14, 3 doses. Is there how people are compliant to follow through and convenience, whether their visits to their primary care providers, non-sick or non-specific immunization visits can be used as opportunity to increase this immunization. So we are assessing that on the parental side as well as on the physician side. So I do hope that it will increase awareness and will help to boost immunization rates. However, we all know that this vaccine is very expensive. One dose, according to actually Centers of County Department of Health website, was $213 per dose, which can be pretty detrimental still and unaffordable, even though their prices might be much less negotiated, much less than in some other places. So as a hope to move this forward, that we will be able to obtain a bigger grant that will support immunization campaign. But we need this baseline data to identify specific barriers and tailor that program. This is a bigger aim for the project. But of course, the overall, like you said, across the board, low immunization rate of other vaccines, I think it does play a role. We know that. We know that there are resistance for a variety of reasons, that including some misperceptions about this virus and this vaccine that community have. So we would hope to be able to provide better access, awareness with factual data. Yes.
Leah, this is Connie. Thank you so much for your research. It's so wonderful to hear it in progress now, and to hear your proposal months ago and to see you navigate all those challenges has just been inspiring. So appreciate your persistence in the face of those challenges. Just a quick follow-up question on that last one. Does Medicaid cover this vaccine, and do you have a sense of compliance and follow through within a population that would have Medicaid coverage? Just looking at those low-income residents who might need this.
Since HPV vaccine is on childhood vaccination calendar, it is supposed to be covered, and unfortunately I'm not sure how it is practiced, because we also know that some of the services that's supposed to be covered by Medicaid or even private health insurances are not executed to all patients, and that creates huge health disparity, particularly for populations who experience more low socioeconomic status due to, and I have to kind of, emphasize that it's due to systematic barriers in healthcare. So there is opportunity, and health department has vaccine and they accept Medicaid there, but rates are still pretty low. So for us, we do have this hopeful aim to move the tide. I believe that people might not be aware that they have this opportunity for their children.
Thank you. That's helpful.
This is really helpful. Maria, we have a couple of questions in the chat box I wanted to bring up. They're related. One is from Emily about how St. Joseph County might relate to the rest of the state in terms of immunization rates. And then, and I guess I can ask the other afterwards. They're both about how counties within the state relate to one another. So maybe that first question, how does St. Joseph County relate to other counties across the state?
This is great question, and I will have to look into it in more detail and get back to you, because the scarcity of data at the time when we were, writing proposal didn't allow us to have any comparison. There were just big numbers regarding, low rate Indiana of HPV immunization. Indiana as a whole, and 2016 Blue Cross Blue Shield data on that only 1/3 of adolescents received this immunization 4 years ago. But this is a good question that we have to look into it. Thank you.
Thank you for that. And then Carolina also has a question about the counties. She just notes that there's 92 counties in the state. So do you have any plans to expand this study in the future to look at additional counties? And she wonders if there could be a difference between rural and urban counties, or counties with more or less diversity in race, or just differences in race and ethnicity. What your thoughts might be about that?
Well, this is I'll take it as a great recommendation to further development and enhancing our research. If we will be able to secure funding, I think it will be important to continue in this direction, and it will be great to tackle this problem, even though locally, but county by county, and discover these particular barriers, because we know that for other healthcare services, there are disparities based on socioeconomic status, ethnicity, ability, disability, and age, for example. But also, there are disparities based on rural area versus urban area. So this is a great question and a great opportunity for us to enrich our project for the years to come. So thank you very much.
It looks like Rachel's question as well.
Maria, thank you very much for your presentation. I entered about 15 minutes late, so I apologize. They may not have a full understanding of the scope of your research, but my question relates to other obstacles or hurdles, and was curious to know if nationally religion plays a factor with this specific question as opposed to others. And I only say that I share that because anecdotally in this area, I remember when it first came out, when my daughter was in middle school, and we attend a pretty conservative school here, that was a real concern. So just wondering how that compares, you know, what this vaccine looks like nationally, and if religion is a factor.
Yeah, thank you very much. There were many studies done as vaccine was introduced in 2006, even a little bit before that, on acceptance, whether this vaccine is going to be accepted, and religious affiliation was found to be one of the decisive factor, based on the to my understanding that this was based on the way that very unfortunate marketing campaign by pharma giant Merck, who introduced the first vaccine, Gardasil 4, was done, that it was marketed as against sexually transmitted disease vaccine, rather than a vaccine that prevents cancers associated with human papilloma virus. And in many religious community, it raised big red flags and created huge barrier of unacceptability and resistance, because it was translated as this vaccine was translated as open gate for children to prematurely engaged in sexual activity, since they are going to be protected, even though it's just for one virus and just even certain type of this virus. And so you're absolutely right. It had a big outcry for that. I think that over the years, it is this factor became a bit less permanent, but there are groups that still find that this is unacceptable. And actually, I hope that since we are collecting now data from parents and guardians, that and our recruitment points, maybe that's what part that you missed from churches in St. Joseph County. We contact churches, so I hope that we will be able to pick that up and see, is it still a major factor? Is it one of the factors within county? We also hope to be able to capture socio-demographic distribution of people who already vaccinated their children, or who plan to vaccinate, or who resist vaccination, to be able to, again, to understand people in less affluent groups, what is exactly missing to be able to tailor these services to them. So that's our kind of, a bigger aim. But yes, even it is interesting, but even certain religion plays in the practice of a doctor too, and we know that. It can be, patients can receive recommendations to be vaccinated at different times, inconsistently between practices, even though there are, well-established guidelines from, American Medical Association, Center for Disease Control and Prevention. But we know that religious affiliation of a medical practitioner can play a role in these decisions. And so, and since they are one of the points of very major contact and helping in decision makers, that can play a role.
Thank you.
Yes, thank you, Rachel.
This is a fascinating point of the research, I think, especially where it wound up going as you were adapting to your situation, Maria. I'm curious if I could follow up on that, because I was wondering the same thing, how the religion aspect played into the project as a whole, but especially now that you're working closely with churches. Did you encounter any resistance from the churches that you contacted? Were they unwilling to be a part of the study, or did they have any requests about the way that it was presented? Because I'm wondering if any of them might have felt that this was an opportunity for them to tell you more about why they opposed a vaccine or things like that. I'm just curious how what that conversation sounded like.
No, that's great question. And of course, as you know, students contact different churches. There are, you know, some that do not respond, or and others respond with delay, and some other that's, as I mentioned, were quite willing to, you know, distribute flyers as a part of the handouts for their Sunday services, to put them on boards with other advertisement that they have, and then use their email listservs to distribute this survey. However, and I can just report kind of anecdotal story about that. Just today in the morning, I received email from one of the ladies, and I don't know the church affiliation with it, but she wrote that she is a mother of two daughters, and she was happy to participate. And she said she wondered why we would even say, you know, as one of the questions, if they, you know, on a Likert type scale of the, you know, to break misconceptions, learn about misconceptions, that vaccination lead to promiscuity and initiation of sexual contact. She said that I know that's not true, and you probably shouldn't ask that to people. Like, she found that it's in the, I mean, in a positive sense. I took it in the positive sense that there is awareness, and that, like, for this particular, say, family, this is not going to be a barrier. But we know, as going back to, you know, Rachel's also question, that there might be a group of population, and we would like to learn about that, you know, page of population, to be able to tailor through the programming. But so far there was, I mean, I'm not aware of any like true resistance or anything that particularly you know, kind of in way that would not let us move forward. Only those that, you know, would not answer upon contact, which is a fair choice when, you know, working with community and, you know, participating, to engage in participation.
So just thank you for that. That's really helpful. One related question then too would be just thinking about the ultimate sample then you're going to get. You talked about maybe people won't respond if they're opposed to the idea or don't like the topic. But I wonder too, do you have any plans to go back to, say, the schools in the future to try and get a more diverse background for respondents to the survey?
This is a great question, and if, you know, or I should say when pandemic will be over, because I think we might have it for a quite extended period of time as of yet. It will be a right way to go back to our initial recruitment strategy and engaged K-12 schools for children 9 to 17 years old, and contact parents through through school systems. I think it would give us a better, we realize that this initial strategy, we anticipated that it would give us better representation of the population in St. Joseph County. Yes.
Are there opportunities now, even with the pandemic, for, any of us that work in the community with populations that you would be interested in? I work at the Robinson Center, for example, that we serve a lot of racially diverse families in the area. We work with a lot of school children. Do you have any need to continue to connect with some of those groups even now during the pandemic?
Well, this is a great suggestion. Thank you so much, Emily. Very, very helpful. I am going to discuss it with my team, and as we see the data collection trickle in, we will, as needed, I am hopeful to contact you,
Okay.
and then, to give it a little bit better, to engage another source of, recruitment. This is fantastic. Yes, thank you. Thank you very much. Yeah, we will go through RD once again as an amendment, but it's a process, and it's wonderful. Thank you for your suggestion.
I just wanted to thank you again, Maria, for the work you do, and just, you're sharing it here, the challenges of communication, to undo myths and misconceptions and misinformation is step one, and then to get folks to move toward action, and compliance is another step. I noted this morning that that Facebook has just come out with a policy not to allow anti-vax messaging on Facebook. So that's a step of controlling the messaging, right? On the national level, that I hope has a trickle down effect on the local level as well. To number one, get rid of misinformation so that there's a clear pathway for you to insert, accurate information that will advance people's ability to follow through in their own health care. So, just thanks for doing what you're doing. I know it's a big challenge that's beyond the walls of our county or our city, but really glad that you're applying what you can do here. Thank you so much.
Yeah. Thank you very much. Thank you for this opportunity. I don't know if there are other questions, or maybe somebody would like to share what they experience as barrier, and if there was any solution that right away available or still pending, if anybody can share their experiences through these times.
Yeah, thank you again, Maria, as well. I did have a question about working with students, because you had a team, it sounds like, of very interested, energized students back in January. But obviously this project has turned out very differently for them as well. And also, I'm really cognizant of the fact that it's been much longer in overall time than you anticipated, and than they anticipated. So I wondered, what was that experience like in terms of kind of keeping them together and part of the team? And was that a challenge? Were they interested in continuing on, or did you need to have a conversation about whether or not they would continue and what their role might be?
Well, this is a great question. And I think that I was truly blessed with the students, because as a project, was changing, and there were, time delays of processing their, internship monies. And it was so uncertain. They showed I think, unprecedented resilience and still interest and excitement. And however, I thought that it will be fair for me to make sure that they are proceeding with their how should I put it, like a kind of true will, that it's still interested for them, that it enhances their learning, that they're practicing well. So even though they were, accomplishing tasks in a timely manner, always provided the most, accurate updates, I did have this conversation with them and told them if they are able, interested, and stay with the project for the, fall semester and maybe even later on. And they had smiles on their faces and said, yes, we will, we want to proceed. So I think I'm just the luckiest researcher at the moment to have just wonderful, outstanding students who persevere along with me.
I just want to comment, I've found the same kind of resilience and commitment amongst the students over the last year as well, and the volunteers that we get at the Robinson Center. It's been very impressive to see across the board how willing and enthusiastic the students have still been to participate in things like this and to still volunteer their time.
Yeah, this is great. Thank you, Emily. I think probably, I hope that one of the difference that I was able to make in my communication with the students, that I was at all stages, I was very transparent. So whatever barriers came along at our, regular meetings, I will tell them that's what, we are facing. This is the steps that I'm taking. This is the step that I'm persisting with. We hope that it will resolve soon. So, and even though that was delayed, but I think my strength was that I was very transparent with them.
It sounds like a testament to Notre Dame students in general, but then also to the fact that they were a key part of the beginnings of the project as well. So it sounds like they felt an ownership and a part of the project, so that even when things were difficult, they were committed and they weren't going to walk away. So that's fantastic, and a wonderful reminder to all of us about the ongoing long-term benefits of including all stakeholders at the beginning of a project as it's getting going. That's great.
Yeah, thank you, David. Yes, yeah. I was hoping, that I will provide engaging mentorship to them, and you're right, to engage interested student from the early on through all the steps, and being transparent with them in certain, how decisions are made and what barriers we have to overcome. I think that played the role. Yeah, thank you very much in a positive way.
It just strikes me as such great real life experience for the students. Being pre-med students, they may think they're moving in the direction of direct patient care, but they may find that they're really excited about research, and they're finding this out early so that when they move on to the next stage of their education, they'll be better prepared. Or on the other hand, they may decide they're not that interested in research, but you've given them the opportunity to experience the ups and downs of being a researcher. I think that's a great great thing that you're able to provide for students.
Well, thank you very much, Dan. Thank you. Thank you so much.
We have about 5 minutes left. If anyone has any final questions for Maria, or Maria, if you have any final thoughts you'd like to share with the group.
Yeah, I just want to thank you again. Center for Social Concerns, and particularly David and Connie for their support of my project and of my team. I also would like to thank all of you who were present today at this workshop for giving me opportunity to talk about what we did and what lessons we learned. And I will be happy to continue my dialogue with you if you would like to, continue or create new collaborations. Please feel free to reach out. Thank you very much.